थोड़ा और अंधेरा होने दे।
Yes. Draw. I think we are all set now. It is 8 and we are starting now to this 93rd edition. Welcome all of you. A very learned speaker, very experienced speaker in the field on intimacy, sensuality, sensate focus therapies relevant in clinical practice. We all know medicines are mainstay, but only medicines don't work. There are some things that we need to learn around this to complete the protocol, to complete the experience. Next slide, please. My pleasure in handing over the session to Professor Dr. Tufan Pati, sir, who is our chairperson of this program since the beginning. Sir, over to you.
Thank you, Dr. Alim, and welcome everybody. And I take the privilege to welcome all our vibrant moderators, Dr. Alim Siddiqui, IPS Treasurer, Dr. Amrit Pat Joshi, IPS Secretary, and Dr. Vishal Chavra, who is most enthusiastic moderator.
Next.
And next, please. Next.
Next.
Welcome all moderators. Next. Dr. Anita Syam from USA. She's an integrative psychiatrist, sexual medicine specialist, clinical sexologist, sex coach, intimacy and relationship coach, NLP, hypnotherapy, spiritual and pranic healing practitioner, educator, speaker, researcher, and mentor, volunteer and community enthusiast. She had been an university topper, India's first female clinical sexologist and sex coach since 2002. India's first and only to become certified surrogate partner therapist 2003. Privileged to be India's first and only psychiatrist to write thesis in Hijra community. Loves to work with LGBTQ group. Author and co-author for medical textbooks. National and international speaker. Publications in national and international journals. Member and fellow of national and international organizations. Welcome, Dr. Anita. Next, please. Dr. Nirmal Lamichane from Nepal. He is the head of HOD of Department of Psychiatry and Mental Health, Gandaki Medical College, Pokhara Consultant, BG Hospital and Research Center, and Pokhara Consultant, Fistal Hospital, Pokhara, Nepal. Welcome, Dr. Nirmal. Welcome, Dr. Anita. Henceforward, the meeting is yours. Please carry on with the proceedings. And someone will introduce Dr. T.S.S. Rao, and they are the topic of today's discussion.
Sure, sir.
Dr. Nirmal, you will introduce?
May I have that privilege, sir?
Okay. And Dr. Anita, you will introduce the topic. Over to you.
Sure. I think he needs no introduction. Still, I'll briefly give his introduction. Professor T.S.S. Rao. Somebody told me TSS meant something else, but today I've seen his full name. So he's Professor Emeritus in Psychiatry and Chief Coordinator in Psychosexual Medicine, Department of Psychiatry, JSS Medical College, that is Mysore. Immediate past General Secretary of Indian Psychiatric Society, Editor Journal of Psychosexual Health, President-elect South Asian Societies for Sexual Medicine, and affiliated to International Society for Sexual Medicine, 2023 to 25. Formerly President of Indian Association for Geriatric Mental Health, formerly Editor Indian Journal of Psychiatry, co-chair Psychiatry in Human Sexuality section of World Psychiatric Association, publications, research and reviews, 349 books and book chapters, 26 awards and oration, including Marfatia, D.L.N. Murthy Rao, C.V. Raman, Distinguished Scientist and Acharya Award. Total, I think, 26 awards he has received. President, Karnataka Sexual Sciences Academy. And as far as I've known him, I think whatever he's doing in the field of sexual medicine is highly commendable. I think he has brought a revolution in that field. So I think with that introduction, I would like to hand over to my co-chair, Dr. Anita.
So namaste, everybody. Good morning from the US and good evening to everybody around the world. Such a pleasure to see you all, my respected seniors, my friends, colleagues, all the people who were able to join today. Thank you for joining this session. So today's topic is beautiful topic. It's intimacy, sensuality, and sensate focus therapies, which is relevant in clinical practices. Now, sensate focus is a backbone of sex therapy. Anybody who practices sexual medicine, we know how important sensate focus is. So it was developed by Master and Johnson's in 1960s. When both these psychiatrists who developed this technique, it was mainly just for male sexual dysfunction, right? But look at there, we are here 2024, and there's a lot of evolution which has happened in these techniques. And now this is widely used, whether it is for female, with this people with diverse gender orientations. It has become a very, very popular therapy in our clinical practices. And interestingly, we always say sensate focus is more for couples, but I'm sure today Dr. Rao is going to highlight why sensate focus is not only just important in a relationship for a couple, but also to an individual. So we as people who are practitioners of sexology or sexual medicine, we incorporate sensate focus in the relevance of individual and also in a relationship. So I hand over the whole session to Dr. Rao, and I look forward to this enriching talk. Thank you, Dr. Rao.
Rao sir, over to you.
Okay. I'm just trying to share. Share screen. Okay. Sorry. Just a minute.
Sir, if you need any help, we have a
Okay.
technical staff also.
Okay. Are you able to see me? Why
To be able to see you, you have to share your screen. You have just unshared. Screen
Yes, sir.
share.
Now, yes, sir. Yes, sir.
Yes,
We can see you, sir. Yes, sir.
Your whole screen is there. Yeah.
Okay. I'll just.
Double click on the first slide so it can become full screen.
Yes, sir.
It has
Not
become
yet.
full screen? No,
Not
Yes.
yet.
So I think, sir, there's a play button below. I think there should be a, yes, sir. Is that a play button? Okay. No, it's went up.
Oh, sorry.
I think
Sir, I think what you should do is first open the slide,
yes,
unshare
yes,
it,
sir.
Open
stop
the
the share,
slide.
stop the share,
Stop share, is it?
stop share, yes. Then on
Got it,
your,
got it, got it, got it.
without sharing, open your
Ah,
PPT.
okay. Now
And
it is
then,
there?
no, sir, it is not there. Now you open the PPT on your desktop, laptop,
Open. Opened.
PPT open. Now you go to share. And in that, there will be one window where the PPT only can be shared. Actually, you are sharing the whole screen, so it was a bit of confusion.
Mhm. Now it is all right?
It will come,
Yes.
sir.
You have to start the share again. Share screen.
Green. Okay, got it, got it. Got it now?
Yes,
Yes,
sir.
sir. Full stop there.
Perfect.
Perfect. Perfect. Go on, sir. Thank you.
Sex is a trial and error. Before I start off, let me thank the organizers for this wonderful opportunity what they have given. And this is the third one, if I remember very clearly. And just about 6 weeks ago, we had one session on sex therapy as such, and quite a few points which are actually necessary to be understood from what we call treatment point of view. We have covered it there. But today I'm trying to talk about intimacy and sensuality for the simple reason that there are many young people who are taking up this particular field in a significant way, and they should understand that sexual medicine practice is much more than actually just prescribing one PDE5/4 inhibitor. This is one of the important point. Before I start off with the subject, let me just congratulate this whole team of Thursday Musings and somebody running the show for 193rd session. It only shows the extent of high libido all of these people are carrying. Hats off to you all. First, there are quite a few seniors are here, and I can very boldly say my mentor, Dr. Raj Brahmabhat, is there. Recently in contact with Dr. Anita Sham, and it looks like we are knowing each other for generations like that. And her emphasis on intimacy and sensuality is actually something phenomenal. And one or two major programs of what I have attended had brought into focus why this is actually important. Of course, I'm really grateful to Nirmal for joining. And so also there are so many seniors are there. What I will be trying to do, it may be actually something very simple for the simple reason that not to make it too complicated. This is one of the important idea. And many youngsters who are here, it is actually meant for them that this actually a whole session is. There are quite a few seniors who are all practicing in a very big way the sexual medicine, and it is not for you. When you use the term sexuality, actually it carries significant connotation because whole lot of these things. Just one or two small points here. Unless we specify, we all, for all practical purposes, take it for granted that it is a penetrative sex. But in a sexual medicine practice, this becomes one of the small component and one of the easiest component. You make assessment, you find some particular problem, you actually give some medications, and actually he settles down. In fact, this is actually one of the idea. But most important is actually the participative or the relational sex. In fact, if somebody is actually trying to talk about long-term issues related to sexuality, this is one of the most important. Why, when actually this particular issue becomes extremely important, we'll try to look into as we actually proceed. And more than anything else, the recreational component. I have seen actually even sexual medicine seminars being presented in a very boring way. What I am trying to do is actually to make it fun learning, and sex cannot be learned in that particular serious manner. In fact, these are all trial and error method. We all have 1 and 2, and what I can only say is we have done mistakes. We have learned out of that. And that's what actually really matters when we are trying to talk about sexual medicine practice. Just another about 5 minutes for the introductory issues. What I will be trying to do is to make you understand, many people believe sex means it is actually nut and bolt phenomenon. I think that may be the reason why the terminology like screwing other things actually came into being. But when we are trying to talk about sex, it is much more than that. As far as the man is concerned, all erectogenic tissues are situated at one particular place. You give some medicine which acts at that particular point. You give an injection, maybe intracavernosal injection of vasoactive drug, and whole procedures related to that. We can bring about erection. And in fact, at one particular point, when sildenafil citrate was introduced, everybody felt that all the problems what men have and women have actually has been solved. I still remember about 2 years after that, one detailed review which came up with about almost 2,000 plus couples from China, brought the focus that hardly anything has changed. And when you try to look at female sexuality, we realize there is a whole lot of issues which actually need to be attended. So many things are common. But the drugs which act as far as man is concerned, it hardly acts. In fact, there are some newer molecules that have come like fulbanserin and to a great extent brimonidine and some of those type of things. Hardly they have made any significant change in the woman's life at all. So one of the Newsweek article, is it a mind or body problem, actually brings into the focus really good important point which is related to this whole aspect. Why actually, in fact, we all are aware what is actually sex is about, and many people are doing sex. But you try to look at the clients who come and attend your clinic, majority of them, majority of the married people, they are not happy. And more than anything else, women are particularly not just being happy. In fact, this is one of the extremely common this thing what I can say. When actually people brought different issues related to the sexuality, we are all well aware gender identity, orientation, intention forms important component. Desire, arousal, orgasm, what actually the science have documented, extremely important. But there is one Levine what actually mentions extremely important component, what is called as emotional satisfaction. Many of the times, wham, bam, thank you, madam, this is the type of approach many men actually follow. And ultimately, the woman is left high and dry. And this is the consequence what we actually see in majority of the individuals, people presenting with, in fact, you talk about particularly the gender-wise, chronic fatigue, host of minor discomforts, insisting on repeated evaluation, dramatic intensity of symptoms, progressively seductive, relief from diagnostic procedures, asking for, in fact, both invasive and non-invasive techniques, unable to relax during exam, emphasizes emotional cause and de-emphasizes emotional cause, dependence on injection tonics, then you name any of these type of things. They all indicate that there is actually something missing. I have actually, in fact, while teaching our postgraduates, I invariably ask them, in fact, when they are presenting me so many things, do you have any sexual concerns to talk about? Just one simple question, in fact, opens up the floodgate and people come and talk about a lot of things. And when we are trying to look at, there is a significant difference between men and women, we are all aware that arousal and orgasm same, 0.8 second. But to reach that point, actually man takes a different route and woman takes a totally different route. There are many areas like fetish, pornography related issues, men feeling bored very fast, promiscuity strategy, what they adopt, female passivity, behavior in general, too. In fact, what we talk about sex drive, in fact, extremely important point is there is actually wide difference. And when we are trying to talk about women, men, there are two important points you should remember is actually the hormones and social issues which actually dominate the picture. And in case of men, aggressive, testosterone dependent. Here, orgasm intercourse is inevitably linked. It is socially acceptable to enjoy being lustful and want sex. Upbringing actually contributes. And this is one of the reasons what we find that actually men, they want more sex, have more partners, have more sexual dysfunction as they age. But when you are trying to look at female sexuality, there are issues which are something quite different from actually what we talk about men. Intercourse and intense pleasures are not linked. That's why the positive reinforcement which is actually necessary actually misses. For many women, it is difficult to achieve orgasm. Sentimentality, romance, and related things actually occupy a predominant picture. Traditional societies discourage. For many, it is duty than joyous and pleasurable thing, and influence of hormones. And this is one of the reasons. In fact, watch this word, relationship and social relationship status and social norm, that forms one of the most important component. And that's why actually what we are going to make presentation today related to that. At all ages, women more likely to report sexual dysfunction is actually one of the very well documented. Just to look at, in fact, there is one or two small incidences. He made a fortune before he was 30 by hard work, but he still can't make with his wife. It is all over for him in 2 shakes, and she comes more or less on her own. What one will do? In fact, writing some tablet like sildenafil citrate and other related things is not going to work in this particular person. There is something awfully anonymous about their lovemaking. 1, 2, 3, and it's all over. They don't know if they are coming or going. You just prescribe medication and end of the story, not going to work that particular way. He can last forever, but nobody ever seems to care. What can be done? For years and years, they have been making love in the same old way. 20 minutes of foreplay, 20 minutes of union culminating in mutual orgasm, and 20 minutes of catnapping afterward. No quick tricks on the kitchen floor, no mistakes, and no variety. And no matter with whom she has been around, and it takes her a long time to have an orgasm. Some men wait for her and some don't. I can narrate any number of stories which are plus minus related to many of these concepts. All of these things indicate then we are trying to talk about sex therapy, there is something actually missing there. So treating sexual problem is biopsychosocial model is one of the best one. We need to provide basic anatomy, physiology explanations, eliminating myths and false expectation, removing performance anxiety, and individualizing treatment for couples is on a very, very level. What we are trying to look at is the little picture. It is only just bringing about erection alone is actually the issue. You are not going to be a very successful sexologist. Very recently, I was there in one of the ad board program of Pfizer, and there were many consultants, and everyone was telling, please tell what is the medicine, how much should be given, and what actually can be done, and everything should be over in about 5 minutes. We don't have that amount of time. Who is going to pay for you for all these type of things? This is one of the important question, and one of the most important encouraging point there is actually to just prescribe medicine, and that is the end of the story. But there is a big picture, larger social concerns, demographic aspects, and individual satisfaction. When we try to look at, we need to have a bigger picture in our mind for understanding all these things. So this is one of the advances what was made by actually the World Psychiatric Association sexuality section approach, wherein Axis 1, they talk about Axis 1 about 1A, about the sexual problem for which he is attending. Axis 1B is about comorbidities. There is actually a section for disabilities. You can make an assessment related to that. Quality of life and whole other related contextual factors what we talk about. That means we need to look at any problem from a very broad perspective, and this is extremely important for proper management of sexual problems. So what is that little bigger picture? One important message I can give here is actually dysfunction cannot be treated in isolation. Individuals seen in the context of relationship, helping couple function optimally is actually one of the most important reason. And what actually the Ushnav mentions, sex is a conversation carried out by another means. When you are trying to talk about communication, interaction, and a whole lot of other related things, in fact, they actually matter extremely important in any individual's life. And we as therapists, we just cannot actually exclude this thing. And biopsychosocial approach to female sexual function, when you are trying to talk about, see, in case of a man, it is actually almost like a linear model. Desire is there, arousal is there, orgasm, and then resolution. But when you are trying to talk about this Basson's approach, which talks about the circular model, and extremely important from a female sexuality point of view. She can be aroused, maybe difficult, but then at one particular point, in fact, we find that at the peak of responsiveness also, she is worried about so many mundane things which actually happening in the life. One of the joke you can actually try to look at is actually one American, one Italian, and one other country plus Indian. In fact, American telling when I have sex, I spend about 700 calories. The Italian telling about I spend about 900 calories. The African telling I'm spending almost around 1,400 calories. The Indian fellow says, to make her agree, I spend 2,000 calories. That means there is actually some difference between man and woman when we are trying to talk about, and that need to be just kept in mind when we are trying to talk about sex therapy in general. So it is actually looked from positive point of view and both negative point of view. If we start from the love side, love is the answer. But while you are waiting for the answer, sex raises some pretty good question. This is Woody Allen's one of the very famous statement. And when you are trying to talk about drive and needs, we have already spoken about, see, primary drive was there, but secondary drive, sex comes under that. But the amount of energy it has is actually something phenomenal. In fact, this is one of the reasons why whatever one may do, it may not just work at all. We did one retrospective study of about 200 plus patients from clinic and another 200 from the institution. And when we did the analysis, almost around 50% of them turned out to be what we call myths and misconceptions. This rule applies both to the men and to the women. But what questions they were asking, there may be a little difference. In the sense, the men's maximum was actually for masturbation and erection. The third one was related to the ejaculation. So in case of women, about extramarital affair and few more other related things. So they have a lot of questions. And in fact, what can be done? The implicit model of Anand talks about permission giving. In fact, you remove their actually inhibition related to that, limited information for some of the topics you may have to provide, and specific suggestions. It will solve. But there are some small number of patients, it's true, but all said and done, they are extremely important. And this is where actually the intensive therapy comes into the picture. I have my own model of actually how actually to go about. So before I venture into this intimacy related issues, people have ignorance, you correct it by education. People have cultural taboos and you get corrected by permission giving. Poor communication skills and teaching communication skills to them is actually our purpose. Fear of failure leading to the what we call as actual failure. And if there is a particular precipitating factor, correcting it. And we also have, say, for example, somebody is a drug-induced sexual dysfunction. It is a systemic disorder which is a producing problem. PDE5 inhibitors have a very significant role to play in majority of this thing. But when we are trying to talk about intensive therapy, removing performance pressure, and reaching a success actually involves quite a bit of processes. There are actually, in fact, specialists in this particular field may be actually trying to do it in so many ways. And one of the most important, as Dr. Anita was mentioning, the sensate focus and other related things are extremely important. So this is what Dr. Raj Brahmabhat, in one of the presentation, what he had made, the first three levels are very easy for any clinician to attend. And in fact, what psychoeducation we are talking about, it takes care. But many problems cannot be solved by or through brief therapy, like interpersonal conflicts, marital disharmonies, adjustment issues, etc., including erectile dysfunction, premature ejaculation, desire and orgasm problems. They require intensive therapy. Erectile problems, in some individuals, just giving the medicine may be sufficient, and this is what actually we are trying to talk about. This WPA classification also talk about the individual's capacity to be motivated and participate in the therapy is one of the extremely important. They are psychologically sophisticated or not. They are educated or not. Whether they can afford or not. In fact, a majority of these type of issues also get into the picture. And proper training, so also experience is needed for this intensive therapy. And one should almost be aware whether he can do it, finding it difficult, whether he can refer the case to marriage counselor or sex therapist. This is one of the important steps one should be well aware. And when we are trying to talk about sexuality, it's a very broad term. That's what actually we had mentioned in that initial slide itself. But there are two important things, sensuality and intimacy. They form important picture. So let us look into some of the important components. In fact, we have published a book on relationship matters. It was along with Prasad Rao for one of the IAPP program, and the other one related to the intimacy matters, elder security for the Geron. And we have published quite a few articles which are related to. Very recently in Journal of Psychosexual Health, love, veritably a melange of love, intimacy, attraction, and sensuality. Those who are interested positively, in fact, they should go through this article. According to Greek mythology, humans were originally created with 4 arms, 4 legs, and a head. Fearing their power, Zeus split them into 2 separate beings, condemning them to spend their lives in search of their other house. What I am actually trying to convey, marriage actually brings about so many issues and complications.
Maybe let's go.
And one should be actually very well aware of. When we are trying to talk about law, there are so many words are available actually in literature. If somebody opens encyclopedia, in our Indian context, we use different terms like mohabbat, ishq, and many other such things. It is universally, whether everything can be explained on the basis of that, it is almost like sugar is sweet. It has to be experienced rather than actually somebody is talking about it. So when we are trying to talk about love, the love, intimacy, and affection, they go actually together. Affection means liking or fondness, usually without emotional, passionate connotations, a positive term involving good feelings about another person. Eric Fromm talks about the art of loving. And we are well aware there are different forms of lovable, starting from the parents and children, brotherly, motherly. But more important is actually when we are trying to talk about 2 individuals in love, we are talking about the adult intimacy as a related factors. Erotic, complete and exclusive fashion, real root of human intimacy is actually what, in fact, this is mentioned. It is warm, cold. Many people have given many other definitions. 2 people share personal and private thought and feelings. And this actually becomes an extremely important point. We have in Sivarambal, I am very fond of watching this Srimad Ramayana. And I was trying to look at the whole story related to the Sita and Rama and a whole lot of difficulty. There is another civilization which actually talks about many of these things, is actually the Greek mythology, the myth of Psyche. In fact, Psyche, in fact, for the mind, but all said and done, Venus, the queen of, in fact, the goddess of beauty, angry about her, and she insists on what we basically call Cupid, to make her fall in love with something dirty, because she feels difficult actually to match her enthusiasm people have with Psyche. Ultimately, the whole story runs in quite a different fashion, just like, say, Kamdev and other related stories, what we talk about here. What one can say here at this particular point is, in our Indian context also, we have a lot of things which go in that particular fashion. And I precisely, in fact, let us look into this Sternberg's theory 1 or 2 minutes later. Initially, see, we were playing with our neighborhood, this particular girl, and we were very friendly, and we were sharing all the things between ourselves, discussing a lot of things, and things were going on quite nice. So our childhood up to adolescent is actually so beautiful, because, in fact, we could share and play and be good about each other without much difficulty at all. But somewhere, see, we joined medical college, and we were seeing that nice voluptuous girl who was sitting in the front bench, and in fact, our picture gets into this. She can arouse. In fact, this is one of the important theme which actually runs. But we were scared of talking to her. She fell in love with another boy who was actually a highly muscular and athletic fellow. We could not even talk to her. But then, once we have to marry, we look into so many aspects, and we try to marry somebody who is important, who can take care of our children and run our life very smooth way. So, what is actually arouses me is actually something which is missing. And many of the times one tries to create, and a whole lot of these things actually he tries to do, it may not go in that particular fashion. Unmasking some of the things actually becomes extremely important. Whether I'm talking about psychodynamic related, some of the concepts may be, but all said and done, even very simple related things are also extremely important here. What actually, in fact, we fell in love, it actually runs in our this thing for a long time, and it is very difficult to actually get out of it.
तुसी जी कब से जानते हो मेरे हस्बैंड को? 1978 में एक कवि सम्मेलन में मिले थे। तुसी जी शायर हो? जी नहीं, पसंद करती हूँ शायरी। और ਤੁਹਾਡਾ हस्बैंड जी? तब थे, अब नहीं रहे। तो कितनी बार मिलना जुलना हुआ मेरे हस्बैंड के साथ? बस 5-6 बार ही मिले थे। 5-6 बार? लोग 5-6 बार मिले, फिर भी बार-बार इन्हीं का नाम लेते रहते हैं। मेरे हस्बैंड जी। कमल जी, कैसे हैं आप? माय हस्बैंड जी, अभी जामिनी। शिमला कॉफी हाउस, वो भी सम्मेलन। फिराक का वो शेर, शाम भी थी धुआं धुआं, हुस्न भी था उदास उदास, दिल को कई कहानियां याद सी आके रह गई। मॉल रोड पे वो बॉक्स, गेटी थिएटर में हम दोनों का रीरन, हमारा वो फेवरेट गाना।
पापा जी की दवाई का टाइम हो गया है। आप लोगों ने अपना कीमती वक्त निकाला, उसके लिए धन्यवाद।
माँ चलो।
This has something actually wonderful things to do. When actually the partner actually refuses for a whole lot of reasons and many conflicts, many other such things get into the picture, that's where the vacuum is created and provision actually happens for something to enter into this. And this is the story of many of the affairs and lot many things what we talk about. So one of the great work was done in this particular field by Sternberg. He talks about intimacy, passion, and decision or commitment. These are the three extremely important, and a whole lot of permutation combinations actually work out in this particular thing. And somebody having everything, actually the consummate love, intimacy, passion, and commitment is actually something he is really lucky, and these two people are actually blessed. Many of the times, liking, intimacy alone, infatuation, and empty love, these are the three things which actually work out. And many of the times when we talk about love at first sight, and I'll come to that 1 minute later.
En met deze regenachtige Valentijnsdag even een romantisch nummertje.
Oh.
Nooit meer kwam, dan ineens vlakbij je zijn.
So love at first sight may look like, but here it's only the passion. And in fact, people have used the terminology infatuation and things like that. So passion alone may actually sustain. And this is what actually the subsequent whole work related to this particular area has come out. At the different phases, each one has a very definite role to play. In the earlier phases, it is the passion which is at very high level. And as we age, it is the commitment and other related things. In between, intimacy is one of the extremely important. And when we are trying to talk about sexual intimacy, and everyone aspires, unrealistic emphasis on sexual, far too little on intimacy is actually what we find in that today's world. Intimacy in popular film culture, it is precisely the sham. And when we are trying to look at young people, what they actually talk about love and other related things may not actually, in fact, literally has all the ingredients of infatuation, which actually they call by the name, actually what you call as the love and things like that. So whole lot of things are happening. Intimacy cannot be mastered in one day, like how we make omelette. This is one of the extremely important statement. What intimacy means, in fact, there is a sort of attraction, somebody with whom we can be ourselves. Sharing life is someone with whom we can just be a safe haven. Battling with someone when we work with unconscious shadow, having sexual soulmate, and lot many other such terminologies get into. And people have done a whole lot of studies. And for women and for men, one of the commonest thing reported is actually kindness and understanding. These are the two things, in fact, actually dominates the whole picture. I still remember having collected information from about 100 lady interns. Everybody was, in fact, quite a few people had mentioned that she should be very strong and, in fact, dominant and many other such things, which only indicates the relic of what we basically call our culture. Why and how actually we come close, of course, proximity, familiarity, similarity, physical attractiveness, and self-disclosure. These are the few things people have spoken about. And when we are trying to look at intimacy, many believe that men in general, that this is actually a very difficult job. This is not my cup of tea. This is actually the work of women. But unfortunately, absence of it actually can create quite a bit of difficulty. And how it actually starts. In fact, one of the things is in the early childhood itself, this would be actually one of the things which is actually learned.
What? He's not jealous, baby. Nice.
So if we are going to ask which is more important, sex or intimacy, whole lot of things actually get into the picture. So verbal, non-verbal messages and all what we send it to, in fact, the whole lot of issues related to the intimacy, but it's a very broad terminology. Attachment style, family dynamics, sexual identity issues, self-esteem, all of these things actually become part and parcel of this particular whole idea. And it manifests by subjective feeling of love to partner, satisfaction in partner's presence, appropriate self-disclosure, value partner's needs and desires, emotional intimacy, and many other related things. So this is something actually extremely important. Whether something turns out to be healthy or not depends upon childhood. In fact, when we are collecting the history, spending some time on earlier childhood history is extremely important. So it is there. But unfortunately, many of the times, in fact, the partners would be fighting and they may actually believe that we don't fight in front of the child and many other such things actually, but they may. So this is one of the things. And we actually, if we are feeling that we are not going to show it to the children, what we are doing.
ये तो क्या है? नया अरमान, नया शादी कर रहे हैं। आदित्य, अंदर जाके खेलो। पापा देखो हम शादी कर रहे हैं।
अरे बाबू तुम्हारी शादी हो जाएगी, अभी आदित्य अंदर जाकर खेलो।
No, no. You like me? Yes, you like me. हाँ।
और शादी के बाद क्या करोगे?
मैं पापा जैसे सुबह उठूंगा और रेडी होऊंगा।
और फिर?
मन्ना मुझे बैग देगी और मैं ऑफिस जाऊंगा। ऑफिस में बहुत सारा पेपर साइन करूंगा और बहुत पैसा मिलेगा। So cute man.
And then?
फिर मैं घर आऊंगा। अच्छा, फिर मानिया क्या करेगी? बहुत कुछ।
और घर आके तुम क्या करोगे?
फिर मैं उसे मारूंगा। फिर मैं ध्यान से दरवाजा बंद करूंगा और सो जाऊंगा। नो, सोने से पहले मैं खाना लाऊंगी और आप शो करके प्लेट फेंक देंगे। ओके।
So the important point is actually what we actually teach children going to matter. And when we are trying to talk about sex education to the children or the intimacy relationship to the children, how we actually deal with becomes one of the extremely important components. Respect for both genders, establishing proper boundaries, effective and flexible communication, shared system of culturally relevant values are extremely important. And in fact, research has found that there are so many other aspects are there. The message is very clear that in fact, the parental influence is actually significant. And when we try to look at married couple who come for treatment or even cohabiting and all lot of such things are possible, the important point is actually however deficit and a whole lot of these things, maybe the height, the shape, color, a whole lot of these things, she likes me is in fact easy to treat. He likes her, easy to treat. Quarreling, in fact, couple, in fact, it is still possible to treat. Those who have actually not talking terms and staying separately, majority of these type of individuals, in fact, calls for very significant problem of actually dealing with their typical, in fact, issues. That typically begins with feelings of attraction. And when we actually marry, in fact, one of the common attribution is actually attraction of, in fact, the similarity which actually calls for each other. But there is actually complementary traits in the sense that, in fact, a man who is very silent type may like to marry somebody who is actually talkative because he tries to overcome what actually is the deficiency which is actually there. There are a few things like many factors related to what we call intimacy, sense of trust, caring, acceptance, willingness to share innermost thoughts and feelings. These are all to be explored in many of the actually cases which actually present. There are people, men who come and they don't want to bring the partner. There is actually problem. We have to establish in the beginning itself whether we are dealing with a sexual problem or the relationship problem. In fact, he has come now because he is having an affair and he is not able to perform there. This is what actually, in fact, this is a relationship problem. It is not sexual problem. And among the couples, I have seen one of the psychologists dealing with the case talking about self-disclosure technique. I'll not go into too many details what is there in the slide, but the important point, they asked him to write all the things what you feel like. In fact, he wrote starting from adolescent age to this particular thing, every girl he saw, and in the medical college, what he was looking, this, that, and when he presented all this type of things, the wife got so angry, and in fact, this particular marriage went into what we basically call a divorce. So one of the important thing is actually whether in fact, the partner is having the what called the mental capacity or the personality traits to handle this. Trust, self-destruct creates mental low maps, and high levels of negative disclosure can result in conflict and anger. These are the few things we as therapists, we need to remember. There are quite a few issues, and there are too many things are there, but I have just reduced it to a few important points. The jealousy. In fact, many of the times,
कहाँ हो?
ऑफिस में हो? क्यों, क्या हुआ?
हमारी पड़ोसन भाग गई थी इसलिए पूछा।
पागल वागल है क्या?
Many of the times, it is actually the power struggle. When we are trying to talk about intimacy, there is no place for power. Failure to provide emotional support, lack of it, reluctance to discuss innermost feelings, lack of satisfaction, how it can be improved, all of this type of things actually becomes extremely important. And absence of it, in fact, can lead to quite a bit of difficulty. Violence and abuse, which creates barriers of intimacy, is actually very commonly reported, in fact, for the jealousy, that feeling insecure. And when we are trying to talk about women, there are a lot of personality issues and very minor, small things actually, which women feel comfortable about, which actually men feel uncomfortable.
Hey, what happened? वैक्सीन लिया तो दर्द हो रहा है। वैक्सीन लेते वक्त फोटो नहीं निकाला।
This one just small idea.
मैं सोच रही बाल कटवा लो। इतनी मुश्किल से तो लंबे किए थे।
तो ना कटवा।
लेकिन आजकल छोटे बालों का फैशन चल रहा है।
तो कटवा लो।
आपको तो लंबे बाल पसंद है।
तो ना कटवा।
लेकिन छोटे बाल मुझे पसंद है।
तो कटवा लो।
नहीं, फिर लंबे बालों की चुटियां बनती है और छोटे बालों की नहीं बनती।
ना कटवा।
मुझ पे छोटे बाल सूट नहीं करते।
कटवा लो।
हाँ, लेकिन मुझे तो लंबे बाल अच्छे लग रहे हैं।
तो फिर ना कटवाओ।
आपको याद है सीमा, वो जो शादी पे मिली थी, उसको छोटे बाल कितने सूट कर रहे थे?
तो फिर कटवा लो।
और अगर मुझे सूट ना किए बाल तो
फिर ना कटवा।
लेकिन लंबे बाल संभालना बहुत मुश्किल है।
कटवा लो।
लंबे बालों में चुटियां अच्छी लगती है और छोटे बालों में चुटियां नहीं होती।
तो फिर ना कटवाओ।
लेकिन आजकल चुटिया का फैशन भी तो नहीं रहा।
कटवा लो।
छोटे बालों के स्टाइल कम बनते हैं।
तो फिर ना कटवाओ।
लंबे बाल सिर्फ जूड़ा बनते हैं।
तो कटवा लो।
ओफो, इनकी ट्रिमिंग बहुत मस्त। मैं सोच रही हूँ कि लंबे बाल रख ही लेती हूँ। शॉर्ट बाल ज्यादा आजकल चल रहे हैं।
कटवा लो। कटवा लो। आओ, कटवा लो।
We have heard of, in fact, the valence, punitive poly, suffering Susan, wavering Winfred. In fact, many other such terminologies have been used where it actually drives. And we have come across couple, in fact, the whole going for divorce because she actually squeezes the toothpaste tube in the center, which actually become one of the major issue between these two people. So for a successful this thing, well, the whole session may actually be necessary to see that in fact both of them put this effort, sacrifice, and forgiveness. All these things are extremely important things. For barriers of intimacy, when we are trying to look at, there are many. And important point is actually many people find it very difficult to commit for the simple reason that this is actually can be one of the very important area. They find it so difficult. Deceiving partner. In fact, this may be one of the most common, this thing, one of the very commonly encountered issues.
Wow.
Who was it?
I don't know. Didn't say anything, just hung up.
Why'd they hang up?
I had the wrong number.
Why would someone call a wrong number at this time of night?
Calling the wrong number anytime of night.
Why would they pick this number?
I don't think they picked this number, probably just got the wrong number.
Is it a signal?
Is what a signal?
Your friend that called.
He's not my friend.
He's not?
No,
But you said they didn't say anything.
they didn't.
Then how do you know it's a he?
I don't.
But you just said, he's not my friend.
It's just a figure of speech when you say that. See, well, what I should have said was, whoever it was, didn't say anything.
And why didn't you say that?
I don't know. I wish I would have.
Is that part of your plan?
What plan?
To confuse me?
How would I confuse you?
Very simple. You just said it was a he, when it's really a she. But then you're saying whoever to confuse me.
That's confusing me. She who?
Don't ask me, she's your friend.
There's no she. That's just the wrong number. I know. Wow. Yeah. Look, there's no she. Somebody just got the wrong number. That's all. That's all that was.
Was that a signal?
Why?
Closing the window.
I closed the window because I was cold.
Well, why didn't you close the window before you got the signal on the phone?
I wasn't cold before I got the signal. Look, it's no signal, see? No she. It's the wrong number on the phone. I just closed that because I was cold. That's all. I go to sleep. Oh,
Are you sure she saw that?
what?
The lights go on and off.
Did who see that?
You tell me, she's your friend.
Martha, why don't you just go to sleep? It's 2:30.
How did you know it's 2:30?
That's what the clock says.
Or is it because she said she was gonna call at 2:30?
Oh,
The girl that's waiting outside for your signals of closing the window and turning the lights on and off, that's who.
look, there's no girl, there's nobody waiting or anything. That was the wrong number. Do you understand? Now, why in your wildest imagination would I want to even mess around with another woman? You know I love you. Crying out loud. Get to sleep, will you? Gosh.
Honey, I'm sorry. I guess I'm just jealous.
Well, that's no reason to be. I love you. Now you just go to sleep. I gotta get up early. Huh?
I love you too, and I'm sorry.
All right, don't worry.
You open that door and I'll blow you.
So deception can be one of the most difficult things in many relationships, and one has to actually look into. So how one can actually maximize? I'll try to run a little faster. Communication is one of the most important aspect, and without communication, you are nothing. How actually to improve all this type of things? In fact, if I play around.
चलान तो कटेगा मैडम।
पर मैं फोन पे बात नहीं कर रही थी।
मैडम आप काय को इतना बहस कर रहे हैं? चलान कटेगा, बस कटेगा।
मैंने सिर्फ अपने हस्बैंड को कॉल लगाया था, बस दैट्स इट। बात नहीं कर रही थी मैं।
अरे कभी कह रही कॉल की थी, कभी कह रही बात नहीं करी। यार क्या फाइन दीजिए आप।
यार आप ऑफिसर हो, आपको ये भी नहीं पता कि बात करने का मतलब क्या होता है। हम बात कर रहे हैं, मैं भी बोल रही हूँ, आप भी बोल रहे हो। मैंने अपने हस्बैंड को कॉल लगाया था, सिर्फ मैं बोल रही थी, वो सिर्फ सुन रहा था, बात नहीं कर रहे थे हम लोग।
So the important point is, in many relationships, this may be one of the major important area, and there are multiple obstructions which can come about in this communication process. And we are all well aware of, see, men in general, they were deficient in what we basically call some of the special faculties. Hearing, we are about 30% less than actually women, and this is one of the things which actually leads to quite a bit of difficulties. So effectively with these skills and all, actually how to train them. Non-verbal communication, whole range of issues are there, and it is extremely important that they should be actually given proper idea. When we are trying to talk about communication, men actually fail, and one of the important point is, there were two couple.
कुछ बोलोगे?
Yeah, my name is Ajay Sharma. I am an IIT graduate working with IBM company. My annual package is.
ये सब तो तुम्हारे रेज्यूमे में भी लिखा है।
तो क्या बोलूं फिर?
You know, शादी के बाद सबसे ज्यादा क्या मैटर करता है?
पैसा?
प्यार। प्यार मैटर करता है। Romance is the most important ingredient of a successful marriage. आता है?
हाँ?
रोमांस करना?
आप
ओह गॉड, इस अनाड़ी से पाला पड़ा है।
कैसे करते हैं?
कुछ तारीफ करो।
किसकी?
ये बेंच की, गार्डन की, मौसम की, मेरी।
बेंच बहुत मजबूत है, मौसम प्लेजेंट है, गार्डन में पानी देने की जरूरत है, तुम बहुत खूबसूरत हो।
छोड़ो।
तुम्हारी आंखें बहुत नशीली हैं।
छोड़ो।
तुम्हारे बाल बिल्कुल रेशम जैसे हैं।
छोड़ो।
और तुम्हारी आवाज कितनी सुरीली है।
ओह गॉड, अब छोड़ो भी।
इतनी लंबी लंबी तो छोड़ रहा हूँ, और कितनी छोड़ूं?
Get lost.
अरे रुको,
You will die a bachelor. Failure.
Many of the times, many simple things actually, in fact, interfere and.
मर गए बेटा।
This is so romantic.
आज शामत पक्की है।
एक सेकेंड, खाने से पहले प्रे तो कर लो।
हे प्रभु, ये सब सहन करने की शक्ति देना, प्लीज।
वो खाना अच्छा बना।
हाँ, मैंने प्रे किया। टेस्ट करके बताओ कैसा बना। दिखने में तो बहुत अच्छा लग रहा है।
एक सेकंड, दिखने में तो बहुत अच्छा लग रहा है
मतलब दिखने में अच्छा लग रहा है?
No, you didn't say that exactly. You said दिखने में तो बहुत अच्छा लग रहा है।
हाँ, तो वही तो बोल रहा हूँ, सेम टू सेम।
No. It's not the same. There is a very big difference.
क्या?
दिखने में तो बहुत अच्छा लग रहा है मतलब खाने में खराब भी हो सकता है।
मैंने ऐसा कब कहा?
Just now, जब तुमने तो पे वो लिटिल एक्स्ट्रा स्ट्रेस दिया तो तुम्हारा मतलब यही था कि टेस्ट में खराब भी हो सकता है।
नहीं, लेकिन मैंने ये सोच के नहीं बोला।
Of course, तुमने ये कॉन्शियसली सोच के नहीं बोला, लेकिन तुम्हारे सब कॉन्शियस में यही सोच थी, इसलिए बिना सोचे बोलने पर तुम्हारी सच्ची सोच सामने आ गई।
प्रभु, मेरी प्रेयर अपने तक ही रखनी चाहिए थी ना।
अगर मेरी कुकिंग से इतनी ही प्रॉब्लम थी तुम्हें तो मुझे बोल देती एक बार, मैं इतने एफर्ट्स लेती ही नहीं। If I knew it's a torture for you.
Oh, I wish I could. अरे बेबी, मेरा ऐसा कोई मतलब नहीं था यार। Na consciously, na subconsciously. You are unnecessarily reading between the lines.
Oh, really? Then you could have used a better line to show your true feelings. Like, खाना देखने में भी अच्छा लग रहा है.
But isn't this sentence logically wrong? I mean, बिना टेस्ट किए कोई ये कैसे बता सकता है कि खाना देखने में भी अच्छा लग रहा है?
ठीक वैसे ही जैसे बिना टेस्ट किए तुमने पहले ही ये तय कर लिया कि ये खराब भी हो सकता है.
Okay, I take my words back. ये देखने में भी अच्छा लग रहा है. अभी तो ठीक है.
अभी भी ठीक नहीं है. ये तुमने भी में जो ताने का तड़का डाला है ना, I can smell it loud and clear.
कौन सा ताना? कौन सा तड़का?
ये देखने में भी अच्छा लग रहा है. ये जिस इंटोनेशन के साथ तुमने भी पे स्ट्रेस दिया ना, सब समझ में आता है.
अरे बाबा, मैंने इतना सोचकर भी पर स्ट्रेस नहीं दिया.
Exactly my point again. ये तुम्हारे सबकॉन्शियस में था. दिल की बात जुबान पे आ ही जाती है इवेंचुअली.
ये देखने में भी अच्छा लग रहा है.
ये क्या कर रहे हो?
विदाउट एनी फीलिंग्स बोलने का ट्राई कर रहा हूँ रोबोट की तरह. ना कहीं पे एक्स्ट्रा स्ट्रेस होगा, ना मेरी कोई एक्स्ट्रा फीलिंग, ना रहेगा बांस, ना बजेगी बांसुरी.
मुझे तो पहले ही पता. You have no feelings for me. तो मेरे बनाए हुए खाने के लिए फीलिंग्स कहाँ से आई? I should have not done all this, you know. I should have just thought.
Sorry. Please. I didn't mean to hurt you. मेरा ऐसा कोई मतलब नहीं था. अच्छा, मुझे माफ कर दो. मेरी जो भी गलती हुई हो, consciously, subconsciously, unconsciously, definitely I apologize. Please do know what you are.
In many relationships, this way, actually, it's for small things. Ultimately, when you are trying to look at sexual communication is actually something one has to work on. One of the Western concept is how can you fall in love with somebody you don't know? Two, in fact, East, how you can fall in love with somebody after knowing her. In fact, this may be one of the extremely opposite pattern what we see. Many of the times, communication actually becomes one of the extremely important issue. And when we try to look at brain and its mechanisms, in fact, the women are extremely common with the expression of emotions, but men. Men almost, in fact, they are like statues. In fact, they find it so difficult actually to express emotions, and this leads to quite a bit. And if we try to look at brain, in fact, there are so many things are there which actually talk about which are dominant in case of. But cognitive empathy, emotional empathy, and other related things, they are very poorly developed in case of man. What is actually being said is that man's brain is actually bigger, but unfortunately low capacity and wrong connections. Woman's brain is smaller, but it can actually work quite differently and very big capacity. Men are very much worried about, in fact, the sex much of the time. Women really have smaller brains, but they use them better than men. And this is the reason why you are poor, because you think of sex when it rains instead of forming. These are extremely common components. And if you try to look at female brain, all those things what we mentioned in case of man, less developed or very well developed in case of female. Mummy brain and a whole lot of other such these things people have spoken about. And feeling guilty, extremely common. And this is one of the things why actually, in fact, she can't get aroused and a whole lot of difficulties happen because of this particular thing. See, for example, a man can close his eyes and think of so many things interesting. But for a woman, thinking about husband only, in fact, wearing this, wearing that, wearing this thing, in fact, this is not just possible for arousal and anything which actually leads to quite a bit of difficulty. And hippocampus, what we talk about, in fact, what we basically, the initial experiences we carry, and this is there in the brain map. And as far as women are concerned, they never forget fight, romantic encounter, and tender moment. But more than anything else, many married people are very well aware they won't let you forget also. I can tell quite a bit of stories related to this, but let me just skip. And when you are using talking about senses, sensuality is actually one of the extremely important triggering necessary for arousal. There are many things which actually can bring about what we call as the arousal. And I can still remember one of the case. The husband coming and telling that she doesn't take bath every day, she doesn't wear nice dresses and a whole lot of these things. And when joined the session, this particular point was brought, her comment was very simple. Sir, please tell him I am his wife, not his girlfriend. Because I am married, I can forget about it, actually, which leads to quite a bit of difficulty. And when we are trying to talk about female sexuality, for orgasm, it's actually oxytocin dependent, unlike, say, in case of testosterone, which other related things, what we talk about in case of man. Oxytocin has that feeling warmth and a whole lot of these things. In fact, the electric sensation, what we get, these are all attributed to. And the marriage, what precisely happens, holding the hand and going for 7 fairas, at the end of it, the sensation goes off. If a man is able to treat his wife as girlfriend, this is one of the best actually, and this is what actually the whole issues related to what we talk about. We all started our life together, and this is what actually one of the point in the Freudian psychology is that women start their life with anxiety, and many of the things which are attributed to because to overcome that particular deficit, struggle and other related things. Men are actually endowed with the testosterone and a whole lot of these things, because of which, though they start their life little later as far as sexuality is concerned, they're 3 to 5 times more involved with sexual activity compared to, in fact, the females. Around adolescent. In fact, one of the best combinations suggested from treatment point of view is actually that the woman who is about 3 to 4 years older than man actually works out. Around 40s, she can become very active. And actually, they were a couple for almost many decades, but now they think in terms of divorce and all happens because of this. And man, either because of the age and a whole lot of other related things, actually he may land up with quite a bit of difficulty. We are all well aware there are a lot of things actually women can do and men can do. And there are only one area where actually people have found a deficit. In fact, as far as
टी-शर्ट के कितने पैसे हो गए भैया? 3000 हो गए भैया. ये लो भैया, काट लो.
अरे तुम पेमेंट क्यों कर रहे हो? बर्थडे तुम्हारा है, ये मेरी तरफ से गिफ्ट है, पेमेंट मैं करूंगी.
अरे एक ही बात है, तूने किया मैंने किया, एक ही बात.
अरे नहीं, मैं करूंगी पेमेंट.
अरे मैंने किया तूने किया, क्या फर्क पड़ता है यार. लो भैया.
अरे नहीं, आई एम इंडिपेंडेंट गर्ल, पेमेंट मैं करूंगी.
अच्छा चल ठीक है, तू कर दे.
ये लो भैया, पेमेंट काट लो.
And many of the behaviors of actually of the men, they don't actually, in fact, feel comfortable. But one of the most important tasks is actually men are not actually trained for a lot of things. And if a woman can understand and make her understand, in fact, that makes a whole lot of difference. So one should understand there is actually some difficulty involved as far as the men are concerned. Woman can multitask, but man cannot. One should be well aware of this particular fact. And this is one of the reasons why actually they find it very difficult. In fact, this is one of the women who had given the slip to the husband, how what actually to be brought from the market. So clear cut. In fact, rather than blaming him, just work out the methodology, how actually, in fact, this particular whole process can be done. And when we are trying to talk about female sexuality, in fact, making her relieved of the daily stress actually one of the important. I still remember one of the very recent couple what I was treating. She is working in Bangalore, leaves Monday and goes there, works and comes back. Early morning she has to get up, prepare food for the in-laws for the afternoon, and comes back at 8 o'clock, and she has to prepare food. She's so exhausted. In fact, where is actually time for sex? These are all few of the things. So the therapy should involve the facility of sex expressions, what all the things can be done. And what we talk about, not only general behavior, whole lot of other related things are also extremely important. With fantasy alone, only about 5 to 10% of the women can reach orgasm. This is what actually. With intercourse situation, somewhere around 29 to 30%. And with what we basically call touch, in fact, almost majority of the women. This is one of the reasons why with vibrator, in fact, every woman can be taken to orgasm. This is what actually some of the reported available, but all it may be looking little actually more. So training the woman in masturbation actually becomes one of the extremely important component, because this is one of the important things she should understand. And when we are trying to talk about, of course, I got a little repeated. When we are trying to talk about therapy, some of the areas we have to actually establish and try to say what are the areas we need to look into, rather than just giving what we basically call just medicine. And the touch is one of the, among all the senses when we are talking about, extremely important component. Related to that, we have a whole range of therapies available. And I'm not going to touch therapies. In fact, Anita Sham may be talking about so many other related things actually one can understand, and which are having actually a significant role to play. So what is the carry home message? Sex is important part of life. Sexual response, not feeling good about one's own or partners, it is intended to enhance loving intimacy. And if there is actually problem that need to be corrected, and for those who are adjusted to dysfunction, don't interfere. But do remember, it is not just giving reassurances or writing prescription is actually the sex therapy. Whole lot of issues are necessary, particularly when you are trying to talk about either both woman or man, more particularly woman. Dopamine, oxytocin, serotonin, endorphin, how best each of these type of things can be combined. Hey, the girl doesn't look for six packs in man, and what is important is
Designed by God to receive. And whatever she receives, she incubates, multiplies it, and gives it back to the male. She was built to do that. So whatever you give a woman, she'll receive it, multiply it, and give it back to you. Whatever you give a woman, are you listening, brothers? She'll never give you back what you gave her. She'll multiply it first. She's designed that way. If you give a woman a sperm, you'll never get a sperm back. She'll multiply it, give you a baby. If you give her a house, she'll multiply it, give you a home. If you give her groceries, she'll give you a meal. If you give her frustration, she'll multiply it. Yeah. So, brothers, if you don't like what you are getting, change what you're giving.
So extremely important that what we actually have to look into. Woman is a beautiful melody when the man is a good musician. And we are actually come out with a book called Embracing Eros, Navigating Intimacy, Sensuality, and Touch very soon. This is all actually calls for effort to be put up. And that way, quality of life, marital life, sexual life, all of these things can be actually successfully integrated in the sex therapy. Thank you very much for giving this wonderful time for me, and I'm really grateful for all of you who are listening. Thank you.
Thank you so much, sir, for a lively lecture and our knowledge update. Over to chairpersons for their remarks, opening remarks.
So yeah, Dr. Rao, it's from me first. I'll go. Thank you for that lovely presentation. My God, your videos are always so impeccable. Right at the point and right at what we need. So let's give a quick recap. I'm sure we all enjoyed Dr. Rao's presentation. And I just wanted to highlight a few points which are very relevant for our clinical practice. So Dr. Rao beautifully mentioned about various aspects of attraction and intimacy. Attraction can be romantic, sexual, sensual. A romantic attraction can be completely emotional, bonding, togetherness, whereas sexual is always involved with sexuality, and sensuality is a combination of romanticism and sexuality. Intimacy can be different forms of intimacy. Since we are sexual med practitioners, we focus mainly on sexual intimacy, which becomes a core in a relationship, right? As a sex therapist, as something which we want to bring to our patients, we want to focus mainly on sex in the form of emotion, bonding, togetherness, not as a goal oriented, not as a demanding, and not as a performance, which is kind of very derogatory when we talk about sex and intimacy in terms of performance. So Dr. Rao beautifully illustrated in a lot of videos how men and women are so different in their emotional needs, in their wants and desire. Where men, it's all about testosterone, where it's all about performance, whereas we have women who are mainly about emotion, bonding. A small kiss in the morning can make such a huge difference in a relationship, right? Secondly, we were also talking about how when we have patients, we not only just focus on the sex part, where we focus holistically in a relationship. And again, the goal should be sex positive, sensual positive, emotional positive, and togetherness and bonding positive. He talked about Plisset model, one of the very popular models around the world, which is used for diagnosing, which is used for therapy. And intensive therapy plays a very important role when we talk about sex therapy, right? Uh, Again, he did a beautiful slide which was put, and he showed a small video from the movie, which is Rocky and Rani. And that is how important, strong the desire and needs are for sex. In fact, the latest research also shows that the way the reward system works in our brains, that's how the strong affinity for sex is. It is that severely strong, and it is pretty long lasting. So when we talk about men as they grow older, it is all about the physicality. They want to have more romance. They want to have more physical connection, want to probably have more partners. Whereas as the women, ages, she wants more of bonding, togetherness, respect, and understanding. Again, two different gender, two different wants. And we as practitioners want to certainly bring a balance in the relationship when we are dealing with patients with sexual dysfunction. He also brought out a very important concept, which is power struggle. Yes, whether it is man or women, if there is a power struggle happening in a relationship, that can be very detrimental in a relationship. And if somebody who is a practitioner should certainly focus on a very important thing, which is power struggle, whether it is a man or a female, right? Very, 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 very important point and very relevant to our practice if we are dealing with couples or sexual dysfunction is communication. Communication becomes a key in any relationship, and you as a facilitator, as a care provider, are going to give that important tool to your patient. Communication in terms of emotional communication, communication in terms of intimate communication, and also I specialize in something called as sexual communication and sexual vocabulary. So there are many times I come across patients and they go, the days and months go by when they have no form of sexual communication. And I tend to bring them various different forms of intimacy, various different forms of sexual communication throughout the day, which starts from the morning. Like, just, how difficult is it for you to wake up in the morning and say, I love you to your partner, right? And it can be both ways, especially because women really want these things. How difficult is it just to give a tight hug? So the recent research also says that a hug which can last from 2 to 3 minutes is a very regenerating type of hug. It should not be a very casual, hey, good, have a good day. So a connection, a bonding which is created with simple hugs, simple kisses, and simple vocabulary. So since we are talking about sex therapy, we are talking about intimacy, we are talking today about sensuality, these key aspects are very important to get a relationship will go stronger and stronger. So let's not forget the last what Dr. Rao said. Whatever you give to a woman multiplies. So if you give love, it multiplies. You give sperm, it multiplies. And if you give frustration, it multiplies. Dr. Rao, thank you for this amazing lecture. I thoroughly loved it. Thanks a lot, and hope all our audience, all our newly budding up sexual practitioners can use all these tips. Thanks a lot.
Dr. Raj Brahmabhat is there. I think he should give some one opinion.
So you're mute, sir. Raj sir, Raj Brahmbhatt, sir, you mute.
I think, it was a very, very difficult topic. The way in which he has handled with the videos and other things, made so interesting. And really speaking, it's like 3-in-1 ice cream. 3 things he has put combined within a shortest time. And I think, Dr. Rao, you have an art of, keeping the audience together, and there is a humor, there is a chemistry, and the things which you have given, I think even 2 or 3 points which we take home, it will be very good. Keep it up. I'm proud of you. And thank you, Anita, you also. You did a very, very well sum up, और आज तुम पक्का गोरी लग रही हो, लग रहा है फॉरेन में है, हम लोग तो देसी लग रहे हैं सब. Take care. Thank you very much. Thank you.
Professor Nirmal, sir.
Yeah. Sir, I think not much has been left by Dr. Anita for me to speak. I think she has beautifully summed up the presentation. One thing I think this presentation has spoken very loudly is that sexual medicine is not about prescribing few medicines. It is much more than that. And this message, at least I have gathered very loudly. And thank you, sir, for that. And it's a sexual medicine in itself is a huge domain. So this message was very clear in today's presentation. I felt like I just came out from a QFX, a movie theater. So, sir, that is a very extraordinary power that Dr. Rao carries with him. And it is always visible when we get a chance to listen to him in any of the conferences, seminar. His halls are all, houseful, blockbusters. So I don't know if we have some time left for any questions. Dr. Alim?
Sir, if there are questions, we can definitely take it up.
Yes, I think there are there.
Most of them are congratulations for a lively presentation, amazing talk, captivating, enriching, hypnotizing, excellent. So these are the adjectives that you have just got. Brilliant, wonderful.
So we don't have questions. So I think
Niska wanted to say something. Niska?
Yeah.
As usual, sir, very interesting. Something you talked about soulmate concept, and something I would like to know about the what is intimacy, and the concept of this sex intimacy, soulmate. We keep on reading these words, but we often get confused. And what about emotions? When it comes to sex, whether it is same for men and women, or there are different things. Like we have been reading about these things, but what is from your practical takes? We will want to hear from you, sir.
I think almost I can say my mentor, another second mentor is Anita. In fact, madam, lot of questions. All these things I actually made the presentation. I think I request madam to answer the question.
So yes, Dr. Sinha, lovely question and quite relevant to our presentation today. I'm going to answer all your questions in parts. Okay. So first question is emotions, right? Now, Dr. Rao talked about this emotional aspect of male and female, right? Both their wants and desires are very different. So where men are absolutely, when it comes to sex and intimacy, it's a performance, it's a goal, right? They want to have erection, penetration done, orgasm done, right? Whereas women, right? Women are not really focused on orgasm. For them, this journey starts and ends with emotion, bonding, togetherness, love, and care. And that's what makes them feel more comfortable and secure in a relationship. So emotion plays a very important role because that drives sex, that drives intimacy, that drives a relationship. So for example, if you have a patient who comes to you with an erection problem, right? And there the problem begins because there's lack of emotions in the relationship. There's lack of intimacy. There's no intimacy communication. There's no sexual communication throughout the day, but then it miraculously sex has to happen. Okay. You cannot enjoy food if you've not cut the vegetables, you've not fried, you've not cooked. So that is the importance of emotions in a relationship, emotions. Talking about soulmate, big concept, controversial concept, right? Who is my right soulmate? Nobody has that right answer. But yes, as I just described, and I always tell my patients, right? So for example, your wife today wants to eat Chinese food and you're absolutely not in a mood of enjoying Chinese food. I'm like, oh, bullshit, I don't want to do that. But again, as a partner, when you accompany her, you basically eat the Chinese food with her and you say, oh, I really enjoyed the time spent with you, right? That is what means a soulmate, because there is no perfect recipe for soulmate, Dr. Sinha. Soulmates are, God has stopped making the perfect soulmate right now. So there comes a concept of desire discrepancy, right? So we come across patients all the time. Somebody has more desire, somebody has less desire. Ma'am, something is wrong with my wife. Something is wrong with my husband. Nothing is wrong with anybody. It is the right balance which you can create, creating a balance of enjoyment, creating a balance of bonding, togetherness, and also being a part of each other's pleasure, right? So that becomes a concept of soulmate. We'll talk some other time of the perfect definition. Now, the last aspect was men and women are very different, dear, in terms of when we talk about sensuality, sexuality, and intimacy. Their understanding, right? Their performances are very different. So you cannot expect both of them to have the same wavelength. But exactly, since we talk about being a sexual med practitioner, a sexologist, we as practitioners try to create a balance between each other's desires, needs, want, and intimacy. Okay, I hope I've answered your question, but maybe soon we're going to have more talks on that. So that was a rightful answer about emotions, okay, soulmate, and also about the various desires and needs between two people.
Thank you so much. Thank you so much, ma'am. And
there are one or two questions now actually in the chat box.
Yes, there is one question by Dr. Z. Reuben in I don't know, how to solve the power struggle. I'm checking the chat box now. And there is this question, let me read it out, by RZ. Can you comment on the fact that the younger generation jumps from one sexual partner to another?
See, this is one of the very important. There is no place for power struggle in intimacy issues, straight away, first point. Once we actually talk about one is big, one is high, and one is important, means automatically we have lost the track. And to make people understand this aspect in what we basically call counseling is one of the very, very difficult jobs. That's why when we are trying to talk about intensive therapy, the psychological sophistication and some of those type of things are extremely important. In fact, many of the times what we talk about intimate partner violence and 100 other things we talked about, they're all related to the manifestation of what we talk about is the power discrepancy that is there between the two. Fortunately, unfortunately, in fact, women are beaten up much more than actually the men are beaten up. And there is, of course, different types of statistics what we have. Anita, madam?
Anangsa Malik.
Wait. Anita wants to make something.
Please.
Just wanted to add. So whoever asked that question, I want to, bring back attention to a lovely video which Dr. Rao just shared. Do you guys remember the video we saw where where the wife serves some food to this person, and then he's like wondering, why is this food like this? Like, she has no expression. And then they go ahead, they have sex, and now he's all happy. So here is this concept about power struggle, where the only need for her was when he comes back home, maybe he wants to when he should show that love, care, and affection, right? It was not something to do with the power struggle of sex. But many a times we come across women and men also who hold on to sex just to have that power struggle concept. Now, how can you break this whole phenomena of power struggle? One is a detailed history, going deep into their relationships, going deep into their intimacy issues, and then tackling each one of them, that why is this power struggling happening? Why is this person holding on to and trying to create this struggle? If you can solve this bit of emotional relationship issues, that power struggle can be solved as well.
Okay.
One of the most frequent method by which actually women exercise this thing is actually denying sex. That itself is one of the important manifestation of the power struggle that is going on between couple.
There's one of the psychological
next question?
concepts, right? There's a psychological concept where the woman wants to hold on to the vagina. But like, I am not giving you my vagina. I'm not going to be involved in sex because this is going to be my power thing. Right. So again, the part of relationship therapy, couples therapy, which very commonly we might, I'm sure Dr. Rao also deals with this kind of, hey, this is my territory, this is my kingdom. I'm not giving to you because this is my power, and I'm going to show that to you. Same is with both the genders. So lovely relationship counseling can be done, relationship and couples therapy can be done in this phenomena.
Sika Ganapati, I think she says there is a dating terms monkey branching, jumping from one partner to the next, but before that, keeping a partner ready in reserve. Does this stem from having a dysfunctional relationship with the primary caregiver and therefore the problem in building intimate relation?
Absolutely. This is not American concept. No, it is absolutely true with, in fact, we are there. In fact, one of the picture, in fact, young people, there are so many people around and whom to love, what to do, and all, a whole lot of these things actually happen. In fact, people jumping from one to the other is one of the extremely common. In fact, in America, they talk about serial dating. But in our country, primarily, predominantly, in fact, multiple partners at any given time. From culture to culture, some of these type of things may actually change. It only shows, see, for example, when you are looking at that love triangle, that commitment is actually something some people find it very difficult. We have one very famous actor. To commit to somebody, in fact, it is difficult. In fact, this is what to do. And this is one of the things which can lead to ultimately not even getting married. And in fact, a whole lot of things can happen. So anything additional extra, madam, again? As a lady, any comment on that?
No, of course, commitment is becoming a big issue in a younger generation. And that's why, they want to try everything, but still not commit. Well, again, it's worldwide, Dr. Rao. It's happening all around. Commitment is becoming an issue because I think nowadays, even the most conservative cultures have become very open in terms of sexuality, where people want to try and test and decision comes later. So commitment is definitely an issue. And my God, look at the jitters which people are facing, premarital jitters. I come across at least 5 patients every day who have premarital jitters. They've seen each other, they've lived with each other, but when it comes to commitment and marriage, the whole different ball game begins. So, well, that's how it is. Commitment is becoming an issue nowadays.
There are a couple of questions left, I think, if new one doesn't come. There is Dr. Nikita. She's talking about a situation where a female partner comes for help to the doctor, but when male partner is called, he doesn't cooperate. In that situation, how to handle the cases? That's our question. I'll read out the second question as well, so that you can.
First, we will answer to
Yeah,
the
Tanya, you'll answer answer it first. Okay. Right, sir. Over to
many
you,
of the times in our clinical practice, men come. But we have seen he has come because, in fact, the lady at home or elsewhere, she has told him, go and get checked. No, you got the point? And as I was trying to tell, if somebody refuses to bring the partner, we have to have in mind that there is actually some relationship issue is actually operating. And many men actually come and tell, my wife doesn't know. In fact, in India, we are really fortunate because many ladies don't make a big issue out of that because, in fact, they are very tolerant and somehow they are concerned about husband's happiness. In America, in fact, it works out in exactly maybe the different fashion. I'm not getting something means I won't stay in that particular relationship. In fact, this may be one of the things. And already those type of concepts are getting into our culture. As far as women are concerned, see, for example, I'll tell you in our clinical practice, I have quite a few women patients who actually come for treatment. That is because, in fact, we have to make them aware that this particular help possible and it can be treated. But out of the 10 women we might have seen, not even one we are successful in treating, not because of anything. There are so many barriers available. She cannot come alone, she cannot come at fixed time, and a whole lot of opposition at home too. In fact, many other such these things, it becomes quite a difficult this thing. In such type of situations, in fact, as I was trying to tell very briefly, see, female sexuality in general is actually inhibitory type. And one of the important things, in fact, we did a study on about 500 plus married women who are staying with the husband for at least 1 year. We are trying to look into, and as I mentioned earlier, it is only around 32% reported masturbating sometime. And among them, only about 12% were reasonably comfortable. See, look at the all inhibitory female sexuality when we are trying to talk about, it is actually training the woman in masturbation and make herself understand what is her body, what is her response and all of that. So even if an individual is there, it is possible to treat. A very successful, important, almost all the requirements it meets, where both the partners are willing to come and they are motivated and they participate. In fact, this is what I can say. And possibly in America, I don't know how actually the woman and the male, how it works out. Madam?
So, Dr. Rao, it's the same everywhere. Okay. And I have recently just got to know that American culture is much more conservative than right now Indian culture, to be honest. Right. But yes, as a practitioner, when we have a female who comes to us with a problem and we get and her partner is not willing to come for therapy in such a situation, what do? Of course, we take care of her first with our detailed knowledge, with our detailed history taking, everything. We get to know if this is a relationship problem, then we try to give this female strategies. So there are two ways you can handle this particular patient. One is what Dr. Rao just specifically mentioned, that we teach her different forms of sensate focus, which is an individualistic sensate focus, where she gets to have pleasure with her own self, understands her body need. And then we'd also try to give her strategies where she can strengthen the relationship if required. Like if she wants to strengthen the relationship with her partner, this can be strategies of communication, showing intimacy, connecting, bridging the bonds between each other, emotional bonding. So there are two ways you can handle this patient. Now, all my mentors who I have learned from, one thing which we don't insist, we don't pressurize, is getting their partners in the therapy, because sometimes because the partner is not willing to join. So this particular patient who has come to you, you deal with this person, you treat this person as a whole. If required, then we encourage the partner to be involved. But if that partner is not ready to be involved, we only tackle the patients.
What was the second part?
So,
yeah.
You told there is another question with the same person.
Yeah.
No, sorry, this is different person. It's Tanya Mathur. The question is, nowadays, people watch a lot of explicit sexual content more than 6 hours a day. How is it going to affect their personal sexual life, if any?
See, when we are trying to talk about sex relationship, heterosexual is actually one of the most difficult job. There are two different types of individuals. In fact, he has to woo and he has to succeed and she has to say yes and all the issues related. Homosexuality may be the second lesser level anxiety. Masturbation may be much less. And from that angle, see, for example, pornography is giving enough satisfaction, relief, and many of those things actually he can get without struggling, without spending either emotion wise or finances wise or social issues wise. In fact, it is one of the very commonly habit forming pattern. Invariably, in fact, this is likely to affect. This is one aspect of it. Second one, when we are trying to talk about pornography, starting from say something like soft pornography to hardcore, the whole lot of issues are there. And if somebody is involved with this type of things and expecting this thing, where it forces the partner and many others such actually can lead to quite a bit of difficulty and ultimately leading to, in fact, the breakdown of marriage and other related things have been documented. So it is a very big topic. In fact, whether you talk about hypersexuality
We'll do
or
it, Sarans.
addiction, that becomes another one very difficult area to answer in very simple terms. But it can affect life in a very big way. As 6 hours and all, it is quite significant. Pornography can help both the people if they are willing and they understand the concept and they have some background sex education. It can add spice to their life. But watching alone, spending all the time, that alone is the source of release, can create difficulties in the marital relationship.
Sir, thank you so much. Actually, we are totally out of time, and I think we have to call you.
The question seems to be never ending, sir. There are more questions are coming. So, Dr. Alim, I don't know how to handle it.
Yes, sir. We need a session on medications used in these issues. So, we can request you and we call you again, and some of the questions we can
Also,
take.
sir, a session on therapies. Maybe Dr. Neeta can elaborate techniques, or sessions on that therapy also. I think that will be different types of therapies.
Pornography also, because
Very
Alim
famous
needs
for
it
giving.
only.
Anita is very famous for giving. We will be more than happy to, I think, address.
Just 2 cents on the last question, if everybody doesn't mind.
Please.
Right? So, yeah. So about porn or even watching light porn, Dr. Rao wonderfully said, two things we have to remember. One is what are the beneficial aspects of porn and what are non-beneficial. Now, when this particular practitioner asks us the question, there are 2 things which is created when somebody is on screen or watching porn for 6 to 7 hours. Imagine you're watching something which is unrealistic, which is trained, which is kind of like really fabricated. So this person starts having an inferior complex or having a different perception about his performance. He starts judging himself, right? And when he goes in a relationship or in an intimate relationship, he starts keeping an unrealistic expectation because all what he's been watching is unreal and fake. So this affects in 2 ways, affects the person, it affects the relationship, right? Now, thirdly, very commonly, which Dr. Rao does agree, that in our practices during sex therapy or in a couples therapy, very commonly we prescribe watching porn, which are soft, romantic porn. This is basically to bring freshness, spice, and just to explore. Okay, this can also be used in a beneficial aspect if use it in the right way, but in the wrong way, it can ruin the person and it can ruin the relationship.
Thank you,
everybody. Thank you.
There are more questions coming up. I think one question I'm also curious about. So, Ravi Ranjan, females in menopausal age group may be sexually reluctant, but the husband may want to be sexually active. So, what to advise?
Biologically speaking, the woman is in fact, the highest sexual responsiveness is after 40s. Because all through, it is actually inhibitory female hormones which are actually affecting her life in a very significant way. Now she is free from many of the drudgeries. And in fact, what we basically call the relative increase in testosterone, interest, arousal, responsiveness, and in fact, need for actually sex becomes something significant. But in our country, following hysterectomy, around 40, 50s, many women are reluctant, not because of anything, but it is a socially ingrained idea that she is not supposed to actually, in fact, get involved. Sex is a of duty. It is actually for procreation. That means I have completed my job. This is where actually the lot of, see, the man becomes naughty at around 40. Woman also becomes naughty somewhere around that 40s. In which one, how actually, how much and all actually depends on a whole lot of other related factors.
Sir.
The geriatric sexuality is
Sir,
something I'm very much
sir,
fond of, and one can talk on that for a pretty length of time. This is what precisely happens. I think final.
We should end the
Sir,
ending now. Amrit, we are ending the. Is it okay?
Yeah, please. Tufan sir, last बोल के खत्म कर देंगे. Let Tufan sir give the last comment, but it's too late.
Yeah. Yes.
I realize it is too late. I reserve for the next session to comments as well as questions. Number one, with the monkey jumping or concept coming up and being accepted of switching dates, is it required to redefine intimacy? I believe it is required to redefine intimacy, sensuality apart. And next, we have discussed about the interaction between male and female. We are kept apart because there is a fifth discussion about the sensuality and intimacy of the LGBTQ population, who have their sexual identity independently as a matter of right, legally, ethically, moral, otherwise. And in the next session, I wish Dr. T.S. Rao will come with exclusive deliberation on that. I don't want to eat into the time, but these are the two things which should be dealt. Thank you, Dr. Rao. Over to Amrit to conclude. Amrit is.
I think Dr. Aleem can conclude.
Another meeting starting, sir. Tufan sir, you can say thanks to everyone.
Okay. On behalf of Indian Psychiatric Society Odisha State Branch, I express gratitude to our eminent speaker, Dr. T.S.S. Rao, TSS meaning everybody knows, and late chairpersons, Dr. Anita Syam, whom I met on this screen for the first time and I'm impressed, Dr. Nirmal Amiche, and our vibrant moderators, Amrit, who has left, Dr. Lim Siddiqui, and Dr. Bisal Chabra, and all the participants in this meeting. Thank you, everybody. And these two issues apart, we'll talk to Dr. T.S.S. Rao to come with 2 or more 3 sessions and one from Dr. Nita Syam also. But I sincerely felt the definition of this thing is changing. It's not same what was there. If you stick to the conservative, maybe we won't reach out to patients. Thank you, everybody.
Thank you, sir. Thank you very much.
Thank you, everyone. Dr. Aleem, good night.
Night.
Thank you, everyone. Good night. Good night.